Today we're going to run down some over-the-counter meds and some supplies that have other uses in the outdoors. In fact, I've used some of these in the clinic. If you guys have some ideas, in fact, one of these I got from one of our subscribers here, and it was excellent. And we're going to run all these down, and then if you guys got some ideas that you've used over-the-counter meds that are medically safe, write them down below. I would love to hear them. The first one is, this is one was provided by one of my subscribers, which makes total sense, is Ambesol, like this. It has benzocaine in it, so clearly it would work great for a mosquito bite or any type of bites that you basically are itching the hell out of. So that works really fantastic because of the numbing agent. One of the things I use is a steroid cream. This is triamcinolone, and that is a prescription. However, you can use hydrocort or any other steroid cream that you can get and over the counter. And if you use a steroid cream, remember to cover it with a Band-Aid. It'll make it more potent because it can't evaporate. Another one right here, Benadryl, diphenhydramine, the liquid, 1% Benadryl, that will help numb a wound. Now, back in the early 80s when I was doing this dance, we would actually take a Benadryl and we would inject it, if we were out of lidocaine, into a wound to help with numbing. It'll last about 30 minutes. So you can take liquid Benadryl, you can take it, put it on some gauze, stick it on the wound, leave it there for a good 5-10 minutes, especially a kid, and it'll help numb the area, and then they're going to feel better, and then you can tend to however way you're going to close it, with tape, with pressure, with Band-Aid, but it definitely will help lower the pain threshold. And what else? We've beat this horse to death in other videos, is Oxymetazoline. It has is Aspirin. Aspirin has the ingredient Oxymetazoline in it, and other nasal sprays has that same ingredient. It does not have to be the brand name Aspirin. So you don't want to use this intranasally more than 3 or 4 days because you can get a rebound and it would be ugly. But you put this on a gauze and it will help stop the bleeding because it is a very good vasoconstrictor. I've used this in the clinic and outside of the clinic and it works really well. Vaseline, and we know you can get these little bitty containers in the travel section at most of your drugstores. Works really good. We know that we put it on cotton balls to start fires, right? So that's a no-brainer. Chapstick also has Vaseline in it, so we can use this to start fires as well as for your lips, as well as a screening protective method for any wound you can put it on. Not that it's actively bleeding, but if you've been scraped up, it will definitely protect it from the elements. So that works really well. Pepcid. I've always preached about having Pepcid. Why is that? It's an H2 blocker, histamine blocker. So I'm a big advocate of using this with Zyrtec or Benadryl or Zysol or Allegra or Claritin. Those are all H1 blockers because this will help tremendously for an allergic reaction. Not just bites and reactions to wasp stings and bee stings, but remember, to my providers, poison ivy, you're having this allergic reaction. Prednisone is not going to be the cure-all. Please, to my providers, add some Pepcid with that or an antihistamine. Works fantastic. So have that in your bag. And we're going to give a free one here at the end. Has nothing to do with the outdoors. Chewable aspirin. We've talked about how much to give in other videos. If you have a history of heart disease, what to give if you're concerned about you might be having a heart attack in the outdoors. But what you can do is you can take one chewable aspirin and you can take that little guy and you can grind it up like in the old mortar and pestle make it into a powder. Put 1 drop of water on it. You have a little paste. You can put that on a wart, just the wart, not on the skin because it'll burn the skin. You do that every day for about a month with a Band-Aid or with a piece of duct tape. Your wart will be no more. It has about a 70% success rate. Pretty doggone good, but the problem with it is you got to be really compliant. You got to do it every day. Can't miss a day. All right, guys, that's all I have. You've tapped my knowledge on over-the-counter meds that you can use for other means. Oh, yes, I did forget one. I did. Eye drops. If you have prescription eye drops and you have a swimmer's ear, you can use those eye drops for the ear, but you can't use ear for the eyes. All right, now you've tapped out my knowledge for over-the-counter meds that you can use for other purposes. If you got some ideas and you've used something in the outdoors, please let me know. Write it down below. It would be helpful to not just me, but everybody else that reads this. All right, keep your eyes on the rise and your face to the wind. We'll see you next time.